New in this morning's Health Watch, doctors in the Democratic Republic of Congo have renewed hope that this rare strain of Ebola circulating is not as complicated as those in the past. Reporter Greg Palcott has the very latest on containment efforts.
This outbreak can be stopped. We're working on vaccines and treatments, but that doesn't mean that people cannot recover from Ebola.
The head of the World Health Organization honored 4 nurses who survived Ebola in the Democratic Republic of Congo. They described the ordeal.
I felt dizzy. That was how it started. After that, I got diarrhea, and they started treating me by putting me to bed.
Many people who were in the same situation as me have died. Coming out of this illness alive is an indescribable joy.
Meanwhile, health officials in Brazil are monitoring 2 patients for possible Ebola infection. If confirmed, they would be the first cases reported outside Africa since the outbreak began in Congo. As the response expands, health officials expect more recoveries, especially with early diagnosis and access to care. A new state-of-the-art treatment center is opened in the heart of the outbreak zone in Congo, with room for up to 100 patients. But in Kenya, plans for a U.S.-backed quarantine facility for Americans exposed to the virus are drawing fierce opposition.
Why do they want to get infected people and bring them to Kenya? Kenya is not a dumping area for such sick people.
There's been no call so far to trigger NATO's Article 5, which requires the whole alliance to respond to an attack on any member. In London, Greg Palcott, Fox 13 News.